Hey, this is Sherry Moringo for Panther Pet Hospital and Parkway Pet Hospital. My 8-year-old Chihuahua Bonnie has recently developed a limp, and Dr. Christine Gibson wants to try a fairly new treatment with a laser. It's painless and it's fast, and the best part is the goggles. This is a great treatment for older dogs with arthritis, and it's really easy on the pups too.
You're okay.
Because the laser, it penetrates tissue, you have to protect your eyes and her eyes. So we've got a little basket that have these are doggles, which let me see if I've got the tiny size for her. So you get to wear these, Miss Bonnie. So her radiographs look fine. I did not see any evidence, and really,
so it's not like out of place.
Well, I don't see evidence of arthritis in the shoulder, but I do see evidence of arthritis in her neck. Yeah, I'll show you the photographs in just a second. But anyway, this part is the and this is where this is. I mean, it's considered a medical device because the danger is if you do this without appropriate eye protection, then you can burn the retinas.
You know, I just had cataract surgery, so I prefer not to do anything weird to my eyeballs.
Okay, so you're definitely getting the
she looks like a motorcycle dog now.
Yeah, so this is her.
Oh my gosh.
This is her.
Poor baby.
She says these humans are weird.
I know, it's okay, honey.
But yeah, so I'll let Mom hold on to her for a second. And then she's like, I can't wait to go and tell my friends.
She can't wait to go back home.
This is you.
But once I take her outside and turn her loose, she'll be all happy.
Yeah,
she'll be running around.
So we cover all, because this is a stainless steel table, we cover any of the reflective surfaces because we don't want the laser light to bounce off.
Can you stop?
So what I'm gonna do is give Gina these, and all I got for you is these. Just here's what we'll do.
I just closed my eyes.
I'll keep the laser protected, and so this is so like I said, it's a cold therapy laser, and the way it works is this device transmit wavelengths of light that they know penetrates tissue, and so when the screen comes up, we'll see it. Depending on the condition, you apply different frequencies, power, and then different treatment durations. So this particular one, it's an MLS laser, is already programmed for different things. So for Bonnie, because this is a chronic injury, what we're going to do is press so we're going to treat, because she's a dog, and it also varies if you have light skin or dark skinned animals. You
and probably by weight too.
Well, and that's what this
you need a tic tac.
So for her, we're going to do. I think I'm going to go with this arthrosis setting, just based on what I saw in her neck on the radiographs, and then we're just going to do the small. Well, actually, we'll do medium. And then when I hit start, it's ready to go, except for the fact that this is the transducer that modulates the light. So for Bonnie, what my choice, because it's the left shoulder that's giving her trouble, we're going to treat the shoulder joint, and then because I'm also trained in acupuncture, we're going to treat some of the acupuncture points on the neck that affect the front limb. So basically, I like to start with just this. This is
okay,
and let her face that way. Yeah. Okay. And so this first point is called governing vessel 14, and it is a heat clearing. And I know all this sounds, and in fact, we make fun of it and call it woo-woo medicine. But we've seen some really good results with it. So this is just basically introducing wavelengths of light into her tissues. The light then works at the cellular level where the mitochondria are, and the mitochondria is what it produces the factors that help your body heal. So this is why we X-ray first, though, because we don't want, if there's a cancer suspect, you don't want to make those cells stimulate.
That's her nervous yawns.
See, that's
when she gets really nervous, she yawns.
So this is right at her.
The next thing up is the dental work.
The dental. Yeah, somebody said back there she needed a tic tac.
Yeah.
So this is treating the shoulder joint itself, and it's the scapulohumeral joint is here. And then I think you can see Bonnie doesn't care, like this is not bothering her whatsoever.
She just bothered anyway all the time.
She's just nervous anyway. Yeah, so we're treating the caudal aspect of the joint and then the cranial or rostral aspect of the joint.
You're going to be okay. She's so out of her comfort zone.
She did really well. I think the radiographs, the dome X-ray machine having to warm up is what got her a little stressed. What we usually find is when patients come back frequently, they know that this makes them feel good, and so they come in and they're like, "Hey, I didn't get my temperature taken. I didn't get a needle.
Nothing invasive.
Nothing invasive." And so, what a lot of the pets that do this frequently, they enjoy their visits.
I really feel like I need to invest in some of these little goggles for her, though, because when she's outside, it's so hard for her.
Yeah.
She basically walks around with her eyes closed when it's real sunny.
I took my Chihuahua to a football game one day, and I brought these just to be extra. But so what we're treating here is the points in Chinese. It's called the cervical Jingjia Ji, which I don't know how to spell it. I'm probably not saying it correctly, but there are points along the wings of the cervical vertebra that.
How many vets are actually certified in acupuncture? Acupressure?
Acupuncture. So I'm a CVA, which is a certified veterinary acupuncturist.
Okay, girl. You gotta keep these over your eyeballs. Stop.
I'll hold that. Hold on, baby girl.
Hold on.
So we're treating both sides of the neck because on her radiographs, I could see. I'll show you this. I see evidence of
It's gonna be better.
spondylosis in her. And it's kind of at the lower down cervical vertebra. So those are tricky. And I feel like with her, it's important to protect her environment at home. So she's not. No more can she jump. Like you probably need to invest in some stairs or something for her. Yeah. Because
no, she doesn't jump off of anything.
She doesn't.
No. She if she gets on the couch, she jumps up on the couch. Okay. But she is only allowed to get off the couch if I put her down.
If you put her down, okay.
Yeah. No, we've had long discussions about don't jump off the couch.
Well, we also noticed that her knees are not. She's got the luxating patellas.
Oh yeah. Welcome to being a Chihuahua.
Okay, that is true. Okay, I'm going to treat this. This is a Chinese point called large intestine 10. They call it the front limb 3 mile point. If you acupressure or acupuncture or laser this point, that you can walk 3 miles every day until you're 100 is what they say. On people, it's right here. You kind of feel that little area there. And so what we've got 5 points left. So now that we've treated the front end, we're going to go to the back end and treat just for balance because we don't want to see, girl, those knees. So I'm going to go ahead and treat a knee.
I know.
I'm also going to treat. I've got 3 points left. I'm going to treat the. There's a point for arthritis in dogs that it's at the top of the.
Yeah, that's
on the last rib
where her scars are.
Yeah,
right there
she's got some pretty good divots there. So this we'll do both sides here, and then we'll do this. There's a last point right here in between her pelvic bones. And so, Sherry, you can do pressure on these points at home too. So just like where you think this is a pretty good one right here.
Yeah.
So just gentle massage there, and then just kind of what you're thinking. The only way that the vertebra get nutrition is by motion. So the older you get and the more stove up and stiff you get, the less nutrition you get to those intervertebral spaces. Is that it? That's it? Mm-hmm. Okay, that was it.
Ta-da!
So another thing that I would recommend for her is just doing range of motion exercises.
Yeah.
And so you want to just go just past what her normal range of motion is and see how we're doing that little bit of flexion. Yeah. Not very hard pressure at all. And then if she allows it, just really gentle extension.
She's going to do physical therapy.
Yeah, that's right. But she's stiff on both of her shoulder joints, which makes me think that the neck is...
Well, she's also very lazy.
Yeah.
That's why I feel like I need to have a second one in the house so that she's not so sedentary.
Yep.
But if I'm not there, she will not move.
Yeah.
She doesn't come out.
She gets under the blanket.
But if I'm not home by 5 o'clock, he says she goes to the door and looks for me.
So see this right here, just this little gentle massage.
Okay.
And I think that's, if you want to work on just really gently And I would do both legs. Cause
Now,
both legs are
with a
really
laser
stiff.
treatment like this, can I take these off?
Yes, yes, we want to.
So, how long
Go, girl.
do you? How many treatments do you have? Oh my
Yeah.
gosh, calm down.
Here, and this is her delivery too. Yeah, so generally it depends on the condition. The therapy laser can be used post-operatively. So like if you had a surgical wound that wasn't healing nicely, you might require 2 or 3 treatments.
Would you
It's all tied up.
stop? Yeah, weirdo.
For chronic conditions like arthritis, what we generally recommend is a series of 6 to 8 sessions, and then usually we do them like twice a week for 3 to 4 weeks.
Yeah.
And then
Oh my gosh.
But yeah, twice a week for 3 to 4 weeks, and then most patients find that they can get by with like monthly or every 6-week appointments. And
Yeah.
what we generally just ask you is to, and I've got a questionnaire for you to fill out to take home, but just to kind of objectively say, okay, is she, sorry, can she jump? Can she, how is her doing the stairs? How, is that sort of thing, and then, for me, I feel like the physical therapy part is just as important at home afterwards,
Right.
Because you want to kind of keep her strength built up, and it's like
I know.
one of those commercials.
She doesn't
talks
like the
about,
machine.
She's done with it, but one of those commercials talked about neuroplasticity, and what you're doing is when you're flexing these joints and really giving it a little bit more than it should. It's reminding the nervous system that, hey, I used to be limber. I used to be able to do this. And so let me use your wrist as an example. So you're pressing just like that, but notice the sensation after I hold it for just a few seconds. Then you see how it feels like, something's moving there that didn't used to move. So I feel like that is physical therapy.
She's hitting her point now.
Okay, we're done.
Yeah, she's hit that point.
Short and sweet, and I think generally most of the sessions can be done once we establish the points. And this little unusual thing we got off of Amazon, but it illustrates some of the most popular acupuncture points. And so for her, like we treated this point, we treated this governing vessel 14, bladder 23, and so forth. But what we've done is it's gotten to the point where Gina and some of my other technicians, once we do the first protocol and make the diagnosis, then they can do the laser. And so it's quick, and usually the session's 5 minutes, and you're out of here. Yeah, so that's it.
Very cool.
Yeah, well,
Very
it helps
cool.
her.
Technology.
It's neat, yes.
It really is.
And it really, I had a 50% tear in my rotator cuff, and was told to have it operated. But you can't work after you have that kind of surgery for 6 to 8 weeks. And so I used a combination of acupuncture and therapy laser on myself. And I'm healed. I'm functional. I mean, it's probably not completely normal, but I was able to continue working and
That's cool.
Yeah, so I mean, I can't treat humans except for myself.
So
Family
if somebody
friends.
has, a lot of times I feel like that people have older dogs and they start worrying when they're like 7 or 8 years old that they're slowing down or that it's painful for them to get up and down steps. She falls a lot.
Yeah, so
Which is weird.
This should help her, and I think keeping her toenails
hiding.
so she can get full.
Yeah, because you have
extension of
the
calves.
oak floors that she just wipes out a lot.
But yeah, age 7 or
It's my
8
fault.
is an ideal time to get a patient in and get them assessed. I think if you wait until they're already down, it's too late.
Yeah, 'cause she's about 8 now, so.
So this is a good time, yeah. And I think just doing this,
Ta-da!
the goal
You're not
is
gonna
to use laser instead of some of the, some of the non-steroidal medications can be harmful to the stomach and the liver and that kind of thing. And so the goal is to get away from, I think for humans too, is to get away from strong pain medications and use the more natural stuff. Yeah, so
Awesome.
physical therapy, the guys at Care Physical Therapy in Hattiesburg also have helped my shoulder and my kids with sports injuries. So I feel like it's the wave of the future.
Sweet.
Yes.